Hello, Palsy here. I hope your Tuesday is going okay. Today I want to talk about frustration in regards to the diagnosis of Bell's palsy and facial paralysis and how slow changes are seen, how slow the symptoms are changing, how much progress are made. And that is something that there is not really any way around it. You have to be patient. You have to give yourself the time. You have to give the nerve the time to heal. You have to give yourself the time to work on your facial massage and your stretches at first. And if your facial movement have not returned to a normal function after generally between 3 and 6 months with Bell's palsy, then this is when you might need more help in regards to performing particular movement, relearning the proper movement pattern, needing the help of a facial rehab trained therapist specialist, and that is very important. I have told you and mentioned this in many posts before, how most physical therapists are not trained to re-educate the face. Most don't know the difference between regular other musculoskeletal muscles and your facial muscles, and they are very different, both in some of the physiology and the way they are controlled and are moving. So and again, if you get to the point of, you have to be patient. Again, you have to be patient in those. Give yourself a good 3 months and do what you have to do and massage, stretch. You can do acupuncture if that is helpful. You can use different tools to do your facial massage. Do not use electrical stimulation. This will not bring movement. It actually could create more problem. I would say that if you get to 3 months and there's really no changes, this is when you need help, and I would start with going to see an ENT, otolaryngologist, more optimally one that is specialized in facial nerve disorder. They are more likely to know the right therapist to send you to, and that can be very important for the rest of your rehab. But facial rehab is something for the long haul. This is not something that many other, I think, and being a physical therapist, I know about other conditions, obviously. Many other things that can be fixed in, a month or 2 or even 3. This takes a lot of dedication from the patient, a lot of work. It takes, and more so from the patient than the need of having many treatments, actually. This is what's good about facial rehab. You can do most of it on your own, as long as you're doing the right thing and as long as you know and you've been trained. And that is very important to remember that. But once again, you are in it for, you could be in it for a while in regards to make progress, and there is nothing you can do to change that. So do not panic, just accept it. I know how frustrating it is, and just surround yourself with positive thinking. Do some meditation if you need to. Whatever makes you do whatever makes you happy. I would, as much as you can, try to interact with other people. People around you, family and friends. You might not feel like they understand, but they know if you have currently a paralysis, and that's okay. I think if they are friends, they will be supportive, and that's something to remember. You don't have to isolate yourself. If you feel like it is mentally draining and you need some help in that regards, then you should definitely reach out to a mental health therapist or a psychiatrist. I believe this is so underutilized in our society overall, and that could really, you might really need it, and you might not be making a lot of improvement until that is also taking place in your rehab. So don't forget about that part. And I think I might have done several posts on this before, but I think it's important that I repeat this for whoever might find my post only now and might not have caught the old ones. So this is, again, a very important part of the facial rehab is you have to be patient. You have to let things happen. Stay positive, avoid toxic environment, stay around supportive people. There's plenty of support. There are not plenty, but there are supports and groups of supports online that people you can speak to. You're not alone. It happens to quite a few people. And just stay positive and talk to the right people for advice and for appropriate rehab for your face. Sorry, that was a little ramble. Anyway, have a good Tuesday, a good rest of the week. I am starting to pack for my trip to Wisconsin to learn so much more than I know, and how to better serve my patients with facial paralysis. I'm taking this amazing course with some amazing therapists, and I can't wait, and I'm sure I will post and talk about this later. All right, take care. Bye-bye.